Regio carpalis posterior. The anatomical snuff box represents as an triangular depression immediately distal to the radius. It is bounded by the tendons of abductor pollicis longus muscle and extensor pollicis brevis muscle on the radial side and the tendon of extensor pollicis longus muscle on the ulnar side. The anatomical snuff box is most pronounced when these muscles are contracted, that is, when the thumb is extended and abducted. The floor of the snuff box is formed by scaphoid bone. Compared to the anterior carpal region, the skin here is coarser and more mobile. The superficial fascia contains very little adipose tissue. This layer houses venous vessels which give rise to vena basilica and vena cephalica, as well as the terminal segments of nervus cutaneus antebrachii posterior. Superficial branches of radial nerve and dorsal branches of ulnar nerve cross the region, descending to the back of the hand. Here, the fascia antebrachii is strengthened and thickened by transverse fibrous band, the extensor retinaculum. The extensor retinaculum sends fibrous septa to the crests on the dorsal surface of the radius. This results in formation of 6 osteofibrous canals on the back of the wrist. These canals transmit the tendons of the extensor muscles as follows. First, abductor pollicis longus muscle and extensor pollicis brevis muscle. Second, the muscles of extensor carpi radialis. Third, the muscles of extensor pollicis longus. Fourth, the muscles of the extensor digitorum and muscles of extensor indicis. Fifth, the muscle of extensor digiti minimi. And sixth, muscles of extensor carpi ulnaris. Inside the canals, these tendons are developed in synovial sheath. Radial artery courses subfacially through the anatomical snuff box. It passes deep to the tendon of extensor pollicis longus muscle, where it reaches the first intermetacarpal space, perforates the first interosseous dorsalis muscle, and passes to the palmar side of the hand. Within the snuff box, radial artery branches off carpalis dorsalis, which courses deep to the tendon in an ulnar direction. Radial artery takes part in formation of rete carpale dorsale, anastomosing with the analogous branch of ulnar artery and the terminal segment of interosseous anterior artery. From rete carpi dorsale originates dorsal metacarpal arteries.